Hello friends, I am Dr. Sachin Marda, Clinical Director, Senior Surgical Oncologist from Yashoda Hospitals, Hyderabad. July month we create awareness for the sarcoma. Sarcoma is one type of tumor, cancer tumor, which arises from the bones and muscles, that is called as sarcoma. So normally these tumors are very rare, but nowadays we are seeing this kind of tumors quite often, especially in young age, teenage, 10, 20, 30 years. So what are the symptoms and signs? Any lump which is progressing in size very fast or at very high speed, anywhere in the body, like in the skin, chest wall, or in the legs or in the hand, any lump which is growing very fast could be a sarcomatous tumor. Now there are some benign tumors also, like lipoma or fibroma. They are also small tumors, but they are benign tumors and they could be multiple. So most of the tumors, soft tissue tumors, they are benign, but few, means non-cancerous, but few could be a cancerous tumors. So normally what we do is we do some imaging like MRI or CT scan or PET scan to see the extent of the disease and the spread of the disease. Then we do a biopsy, a small sample, we take it from the area and we send it in the pathology lab to confirm that whether it is non-cancerous tumor or cancerous tumor. And then we discuss the case in the multidisciplinary tumor board meeting with a team of doctors like medical oncologist, surgical oncologist, pathologist, radiation and other rehabilitation specialists, and then we plan the treatment. Now, one important advantage now with this new technological advancement is initially those who would have tumors maybe 10-20 years back, like in the leg or in the hands or anywhere, they would end up in amputation, like below knee amputation or above knee amputation. That means there was threat to lose the limb permanently. But now with the advancement of 3D printing technology and AI enabled artificial prosthesis which we put into the amputated area, maybe in the hand, maybe in the bone, and we will preserve the limb, that is called as limb-salvage surgery. So we are doing now this kind of advanced limb-salvage surgeries without having need of amputation and lifelong disability. Along with that, sometimes we do chemotherapy or radiation therapy or targeted therapy to give the patient his limbs, legs or hands intact as natural. So there are many patients who have came to us and we have treated them without any amputation with limb salvage surgeries, and they are living now normal, they are walking, they are doing cycling, they are doing swimming, and they are on their legs and on their toes. So I take this opportunity of July month just to create awareness in the society that any tumor or lump on the extremities like hands or legs or on the trunk which is growing alarmingly with little high speed or it is little worrisome, causing pain, tingling, numbness, please consult your local physician or doctor or maybe with us at Yashoda Hospital so that we can clarify all your doubts and we can treat you well. Thank you.
Like, comment and subscribe for more health updates.